Inflammation is an important aspect in biology, and it's a protective mechanism that our body does, but ironically, it's also a root cause of many diseases. Inflammation is our body's immediate reaction to injury or infection, and it has many stages. First is the alarm phase. Tissue damage triggers the release of chemical signals like cytokines, prostaglandins, and histamines, and these are our body's first alarm signals that call for a defense response. Next, we have vascular changes. In response to injury or infection, blood vessels in the area dilate, vasodilation, which increases blood flow and leads to redness and warmth. The blood vessels also become permeable so that immune cells and fluids can go to the damaged tissue or infected tissue, which causes swelling or edema. Next, neutrophils and macrophages, which are white blood cells, are the first responders to the site. They will neutralize pathogens like viruses and initiate repair, but they can also contribute to tissue damage if there's too much. Inflammation may in some cases transition to chronic inflammation, which is a key player in numerous diseases like autoimmune diseases where, for example, in rheumatoid arthritis, chronic inflammation leads to joint damage. You can have cardiovascular diseases where there's persistent vascular inflammation. In terms of type 2 diabetes, inflammation can impair insulin action. For digestive diseases, Crohn's disease and ulcerative colitis are inflammation here in this area. And then we can have respiratory illnesses where there's ongoing airway inflammation. Also, long-standing inflammation can cause DNA mutations, which may promote cancer. The other thing I wanted to say about inflammation is, for example, when you have a sore throat, that's your body doing inflammation to get rid of the pathogens there. For clinical recognition, the classical signs of inflammation are redness, heat, swelling, and pain, and loss of function, and that's how inflammation is diagnosed. For treatment, inflammation, there's NSAIDs, which is non-steroidal anti-inflammatory drugs like ibuprofen, Advil, aspirin. In tougher cases, you can give steroids. There's topical steroids like hydrocortisone or steroids that people take when they have an inflammation flare-up that calm down inflammation. People study inflammation all the time to better manage ways of controlling disease. Even though inflammation is a very important response and it helps protect us all the time, too much of it can be bad, and it's a big topic in pathophysiology as both a healing force and a potential driver of disease.